Okay, we're live on YouTube. Who do I send this host back to?
Send it back to Carol Gotzel, please.
Okay.
And Alan, I got Angel moved over too. Thank you.
All right, Carol is host again, and we'll be live on we'll be live on UGTV in just a few seconds here.
Thanks, Mariah.
I want to also promote Dr. Alan Greiner. Thank you.
Just kidding, I scheduled this for tomorrow. So let me go back in and fix this. Give me just a minute. All right, we're live.
All right, thank you. So before I call the meeting to order, I want to announce that due to COVID-19, we have individuals attending remotely as well as on-site. All participants joining by phone should mute their phones when not speaking to avoid background noise. During the meeting, please make sure that you announce yourself by name and title every time you speak, so the public that is participating knows who is speaking. This is critical given the number of remote participants and his current guidance from the Kansas Attorney General. I'd ask the clerk to announce the meeting and call the roll, please.
Thank you, Mayor. You're hereby notified that I have called a special session of the Unified Government of Wyandotte County, Kansas City, Kansas, to be held Thursday, April 29th, 2021 at 5 p.m. regarding a COVID health ordinance, followed by a 2022-2026 capital maintenance improvement projects CMIP. Roll call. Philbrook. Philbrook. Bynum.
Here.
Burrows.
Here.
Townsend.
Here.
McKiernan.
Here.
Ramirez.
Here.
Johnson.
Here.
Kane. Kane. Markley.
Here.
Walters.
Here.
Albee.
Here.
Commissioner Philbrook, one more time. Thank you.
Thank you. So we have two topics today. The first item is a COVID-19 health ordinance. I'll turn it over to Mr. Bach.
Thank you, Mayor. The intended update tonight is to talk about where we are with the status of COVID, the vaccination, but we also wanted to start off with a little bit of update from our Parks and Recs Department regarding how we're treating some of our facilities in regard to that. And we're going to let them, I'm going to turn this over to, I believe, Angel Obert to start with. And Angel's going to walk through and talk about how we're treating some of our facilities based on our current our rules and ordinances. And then we'll go to health from there. Angel?
Thank you, Doug. Good evening, commissioners. So I'm just going to update you on what we are doing on Parks and Recreation as far as our COVID safety update. As you know, this has been a very fluid situation for us, and we've been working very closely with the health department, who's done an excellent job of giving us guidance throughout the entire pandemic to ensure that we are operating safely in our daily operations, especially in our amenities and our facilities. So I'll start with our community centers and halls. So our programs and reservations have been restored to normal capacity with the expectation that 6-foot social distancing can be met. Also, masks must also be worn inside of all of our facilities. And any program that we have taking place in our facilities, we've requested that they provide a COVID safety plan. And so what that means is they submit a plan to us on how they plan to follow those guidelines set forth by the health department, so we can grant them the approval for them to take place in our facilities. We have COVID safety signage that is visible in all our facilities. And then also, I just want to note our staff is very excited to begin slowly reintroducing these programs back to our centers and also for our community. As you know, we had a lot of exciting investments through the CARES Act project over these months where we were inactive just due to the pandemic. And so we're very excited to be able to introduce some new programming opportunities through that. Next slide, please. So we'll move to our outdoor facilities, which is our shelters and basically our outdoor courts. So individuals within a public space shall maintain 6 feet of physical distancing from other individuals. And this is unless they are a family. So if you have a family renting a shelter together and they're all in the same household, then they are exempt from that. We also will ask that masks shall be worn while outdoors in public spaces if they are unable to maintain a 6-foot distance between individuals. Again, that's not including individuals who live together. Next slide, please. So big topic is our sports. We just recently, at the middle of March, started to slowly reintroduce sports back to our community. So what that looks like for us in our department is that players may unmask to engage in sports competition or practice, but they must wear a mask over their nose and mouth at all times. So if they're on the sidelines or in the locker rooms or in huddles, anytime they are not engaging in the field or on the court, they must wear a mask. So spectators attending these events, they will be asked to maintain 6 feet of physical distancing in these public spaces. And also masks shall be worn if it's inside in our facilities, if we've got games going on in our gymnasiums. And then also masks shall be worn while outdoors in public spaces if they're unable to maintain that 6-foot social distance. Again, this is not including individuals who live together. And I also just want to note too on this slide, we are working on rebuilding our youth programs. We lost a number of youth to surrounding parks and rec departments. A lot of metro areas around us continued to play sports while we did not. So we have noticed as we've started to slowly reintroduce our programs to our community that our registration numbers are low. But we do hope to see that increase and come back to our normal levels. We've had a lot of feedback from the community during the pandemic, how important it was for them to be able to have something for their kids to do. And now that the guidance from the health department and working closely with them and being able to offer these programs again safely, I think that they will come back and participate right back in their own community. Next slide, please. So now I'll talk about our aquatics, starting with our spray parks. So our spray parks will be open for normal hours of operation. We look for our spray parks to open Memorial Weekend, and that will be Saturday, May 29th. We do have 3 spray park locations, and they are open 7 days a week from 9 a.m. to 9 p.m. So what you can expect at our spray parks is, maintaining that 6 foot of social distancing, except from people that are in the same household. So while kids are at the spray parks playing, they can remove their masks when they're actively playing in the water. But otherwise, if they're around the spray park deck, they should keep those masks on. Also, we will have COVID safety signage that will be visible at our 3 spray park locations. And then for Parkwood Pool, so we do anticipate Parkwood Pool to remain closed to the public for the summer 2021 season. The community, you will probably see the pool will be filled, but this will be to perform routine maintenance just to make sure we are keeping up with everything we need to do at the pool. We do look, while it is filled, to offer a lifeguard training work study program. This program will be offered to youth 16 plus. I know that we are not the only organization. Every aquatic department across the metro area has experienced a lack of lifeguards, and that's we lost a whole year of aquatics. So been a lot of conversations about, just trying to rebuild that program. So we think that this is something that we can offer the community or offer our youth and help strengthen our lifeguard training program and hopefully be set up for success for summer 2022. Also, swimming lessons for youth under 16. We will continue to evaluate this possibility of being able to offer maybe this as a program too for the youth in our community this summer. And so, like I said, this is a very fluid situation, and we've been working very closely with the health department to make sure that we are in compliance with the guidelines that they are putting out. So this information that I've presented before you is what we are currently doing for our daily operations. And of course, as things continue to change, we will adjust here in Parks and Recreation and make the necessary adjustments as we move forward. And then that concludes what I have for Parks and Recreation as far as what we are doing as far as COVID-19.
Thank you, Angel. Are any questions or comments from the commission? Okay, thank you. Seeing none, we'll move on to the next topic.
All right, thank you, Mayor. I believe this turns it over to Julianne Van Loo with the Health Department to lead off our presentation regarding COVID-19.
Yes, sir. Thank you, Doug, Mr. Mayor, and thank you, commissioners, for your time again this evening. I'm actually going to go ahead and throw it to Dr. Corvo to start us off, our Deputy Health Officer.
Thank you, Julianne. Good evening, commissioners and public. Want to start us off by just talking a little bit about where we're at with COVID-19 cases and such. In our community, we're seeing really on average about 15 cases a day right now. And so that's a far cry from where we were around the holidays. It's continued to be low now for several weeks, which is great. Just to give you a sense, we're actually increasing a little bit in the number of tests that we're doing in the past week or two. And despite that, the number of cases that have been positive have remained low. So we're doing about 400 tests a day and averaging again about 15 cases. Next slide. We're seeing also this kind of interesting trend that, now later in the pandemic, we're seeing that the average age of our COVID cases has decreased, has gone down. So we're seeing more cases in our younger people and fewer cases in our older folks. Of course, the average age was just 39 back in November, but I think it showed that, a lot of our older folks in the county were struggling. Of course, we were so afraid for people who are older to get the virus and then become quite ill. I think the majority of our hospitalizations and deaths were, of course, in our older population. So we feel as though the vaccinations are making an impact in our community. Next slide. Next slide again. We're going to transition now and talk a little bit about how vaccine uptake and numbers and such are going in the county right now. So this is pretty interesting. So 1 in 5 people in Wyandotte County have completed their vaccine series, have either one of the Johnson & Johnson vaccines or have received both doses of the Pfizer or Moderna vaccines. We also see that 28% of folks in the county have at least one dose, which is looking much better and getting better with time. Next slide. You can see here that, of course, we initially began vaccinating our older folks in the county, 80 and up, and then dropped down to 65 and up. So you can see that the majority of those folks 65 and older in the county actually have at least one dose of vaccine. So we're almost 61% of folks 65 and over have at least one dose. It's the younger population that we're struggling a bit more with, 16 to 65. We have about 37% of the county has at least one dose. And of course, vaccines haven't been available to these age groups for quite as long as the older folks, but still important. Trying to push the vaccines in younger folks is going to be a real important part of what we continue to do. Again, here we see for age-specific rates of vaccination, we see that in 65 to 74 and then 75 to 84, we see a really high rates of vaccination in the county, which is awesome. So our job is to get these younger folks who are eligible for the vaccine to go ahead and get it. Next slide. And one more slide for me before I turn it to Dr. Greiner. I think this slide is really very important and interesting. You can see here over on the left, we're looking at number of doses of vaccinations, and then down below here, just the time course through the pandemic since our vaccinations have been available. So you can see then the first dose of vaccine represented by the blue, and the green represents dose 2 or completion of the series. So you can see over here when we look at about the first week or so in April, we're seeing really high number of the first dose of vaccine, but it really peaks then. And then unfortunately, we're seeing a really sharp decline there in sort of first doses of the vaccine that are being administered. Of course, we're seeing a lot of people come back for their second doses, you know, and that's encouraging, but we would really, really like to see more of those first doses and second doses to just kind of continue out. So we're a bit worried by this trend. Dr. Greiner, I'm going to turn it to you now.
Thanks, Dr. Corvo, and thanks, Mayor and Commissioners, for having us tonight. So, you know, as Dr. Corvo is showing us, we've made a lot of progress. We're slightly worried that we don't have the demand we did have there for a bit, and of course, we now have a better supply of things. We've got a long way to go, but there is some good news. This slide here shows us vaccine rates by race, and so these are rates. So you've got the numbers out of 100,000, and we do see here that we're getting closer to the equality we would like to see here. There was a time early on when we really had pretty significant inequality between whites and other groups, but that's improving. We think we can actually push this to where we've got this roughly the same rates across all of these categories. That would be the ideal scenario, would be for all these bars to be the same, and they are better. And so that's an important thing. Part of that, I think, is a lot of community work that's going on. Julianne's going to talk about that some more here in a second. You can go to the next slide. This one's just another look at something similar, not racial data, but ethnic data here. What are the rates per 100,000? We've really got equality here, and we did not have this several weeks ago. And so we're very encouraged by this. We do know that our Latinx population has been hit hard by COVID, so it's a high risk community sector. And so the efforts here of the different teams, I think have really made an impact, again, as has the community work that's been going on and that will continue. Next slide. How are we doing by sex? Don't have equality here. This is not different than a lot of other things we see in healthcare and medicine, where males do not always participate in some of the preventive health services that we would expect them to at quite the same rate. So this is something we're going to have to work on too. It's going to take some creativity, but we've got to get, you know, again, we've got to get all of the population segments vaccinated at the same rates and as quick as we can. Next slide. How are we doing by zip code? This is another one where we've really improved things. You may have seen data we talked about some weeks back where we had really significant differences between the western side of the county and those zip codes versus the eastern side of the county. Things are improving. So we've got things to where at least everyone is in light green. We want to get it to dark green as soon as we can, but we're really making progress. And I think part of that is getting the site at the Armory opened up, as well as, again, all that outreach. Next slide. So what are the goals? What are we trying to do? Well, when we were at our peak about a month ago, we were doing about 5,500 first doses a week, which was really great. And this goes back to the slide Dr. Corvo showed. But now we're seeing a downward trend. The last week or so, we're only doing about 1,500 first doses per week. So when we had limited supply, we had a lot of demand. We finally kind of caught up with that demand and got to that 5,500 number, but it's really dropped off. So there's going to need to be a lot of work to keep pushing this, and especially in those middle-aged and younger population groups that we know are, even though they're at lower risk for hospitalization and death, there's still a group we've got to reach out to. We know that 70%, getting 70% of people vaccinated, fully vaccinated, is kind of our minimum goal for herd immunity. That gets us to the point where we really can feel more confident we're not going to have significant outbreaks and upticks in cases. If we stay at 1,500 a week on first doses, it's going to take us until next year to get to that 70% of the residents. That's a long time. We would like to see that happen much quicker. So there's going to be a number of strategies. We may be moving away, even though the mass vaccination sites have really been wonderful. The staff and the volunteers and everybody working on those has done an amazing job. We're thinking now that it's going to take more than just having sites that people would come to, and it may be getting out to people and being creative. Next slide. And Julianne, are you going to take this one?
Yes, sir.
Kicking it back. All right.
Julianne Van Loo again, the director with the health department. I'm just going to get everybody up to speed on what our operations are right now around vaccine administration. First and foremost, we really want to make sure that everyone in our community understands that if you're 16 years of age or older, you are eligible for the vaccine. In fact, you don't need to even live or work in Wyandotte County to be eligible. So we are vaccinating folks really from anywhere. When we made that shift, we didn't see a huge uptick. So we're not, getting a ton of folks from Missouri kind of running across the state line or anything like that. But we continue to run into folks in our community who just don't know yet that they themselves and their family members are eligible. So we are really asking all of you as commissioners and anyone tuning in to please help spread the word that all of the eligibility restrictions have been lifted. And if you're 16 or older, you can now come to any of our sites and walk in for a vaccine. As Dr. Greiner mentioned, we have much more supply now than we do demand. And the data that you've seen here in the past few slides really show us that we're having lower vaccination rates among specific groups. We are embarking on a number of focus groups with these specific subpopulations to really get into in-depth conversation with folks in our community so that we know why the hesitancy is there, what messaging we can do to help battle that a little bit, what information people still need to make a decision, what communications will resonate with folks. So we're really looking forward to getting some real robust qualitative information as we sit down with groups of these particular folks in these groups to learn about what they need to make this decision. We continue to vaccinate, at our 3 mass vaccination sites. We are prepared to announce tonight a little bit of a change. So we will continue to operate the Kmart site at 78th and State Monday through Friday. It was our first site. It generally has the highest numbers of folks who come through. But we will be downsizing our hours at the Best Buy and Armory a little bit, and that's for particular reasons. So Best Buy will be open beginning the week of May 10th on just Mondays and Tuesdays. The Armory will be open Wednesday through Friday with our staff, and then again, that Saturday option staffed by Donnelly nursing staff and students, which is wonderful. So again, the Best Buy will move to Monday and Tuesday, and the Armory will move to Wednesday through Saturday. We're doing this because we can take the staff from one of these sites and staff both of those sites by virtue of splitting it up by days, which frees up an entire site's worth of staff to do more mobile vaccines. And as Dr. Greiner and Dr. Corvo showed us, with our declining number of folks coming through for vaccines, we've got to get creative. And by and large, what the community is telling us is that when we get creative, we need to come to them. We need to come to where people are. We need to come to where they feel safe. We need to come to where they have community members and leaders who they trust to be on site with them when they consider opting into this vaccine. So very excited to be able to announce that the week of May 10th, we'll be launching our 3rd full-time mobile vaccine group, and this group will actually be able to respond to larger event requests. So our 2 current mobile vaccine teams are fairly small at this point. They can do 30 or 50 in an afternoon, but having a larger team that can go out to requests for a couple of 100 vaccines in an afternoon will really help us meet some of that demand that folks have for on-site vaccines. So along that vein, earlier this week, we launched a new survey online. You can go to ycovaccines.org, and anyone can click on that kind of I don't know what you call that, bluish greenish box there that you'll see on our landing page to submit a request for a mobile vaccine to come on site. So whether you're a nonprofit or a church or a for-profit business, anybody in our community can request an on-site mobile vaccine team. And so we respond to those requests within 48 hours in terms of communicating with folks. We do pre-site visits to make sure that everything can go smoothly on the day of. And right now we're able to respond to the vast majority of requests within 2 to 3 weeks that come through to us. So, but again, that hopefully that timeline for our response will get shorter as we launch that third group. And then just lastly here, that yellowish orangish button is still on our ycovaccines.org webpage as well. And that's where folks can go to request a free ride to or from the vaccines. That program is going well, and we want to make sure folks know that that is still available. So that's kind of the crux of the way we're operating right now. We know, again, that we need to continue to get creative and that we can't do this on our own. We have to do this in partnership with community, or we're not going to get to that 70% that we talked about. So we have really, in the past month, and even just in the past few weeks, ramped up what we're doing on our community outreach and community engagement. So I'm going to run through a few of the initiatives we've got going before we move forward here. The first is a canvassing initiative, and this bore out based on the discrepancy we've seen across zip codes in terms of vaccination rates. And so we have hired folks from these specific zip codes, 6 of them, to do door-to-door canvassing, much like you see in advance of political races. We know that people have a lot of questions, and that oftentimes they most successfully feel that they can make a decision when they're actually able to ask someone those questions and get answers there on the spot. So these 6 community outreach workers have been well trained on what's going on with the vaccines, what people's options are, you know, the science backed by the vaccines as well. So exciting to be able to put those into some of these harder hit neighborhoods with higher COVID case rates and lower vaccination rates. We have also launched our Faith, Science, and Wisdom flagship church initiative, which is going quite well. We've entered into arrangement with 6 African-American churches, whom each are then assigned 5 additional African-American churches, so that we actually all together have 36 churches in this program that we're running. And what we're doing is providing money to these churches to do outreach directly to their members, again, because our African-American rates of COVID are higher and rates of vaccine are lower for that community. So to date, almost 1,900 folks from those churches have been scheduled and come through to receive their vaccine. So, you know, that number isn't as big as we'd like, but the fact that almost 2,000 folks just from this one community outreach initiative from a high-risk community group is coming through, we feel is really positive. We are currently working on identifying some Latinx and Hispanic churches to enter into a similar flagship church initiative. So we hope that we can announce that in coming weeks and months. We've also really ramped up our outreach efforts with our refugee community, with our Congolese community, and specifically, we've identified some Swahili-speaking doctors who are doing online town halls with us. We've gone out to Sunday church services with members in that community, providing that information directly, and us there to answer questions, you know, medical and scientific questions if necessary, but again, using those trusted community leaders as really the voice. Same with the Nepalese community. We had a really great Saturday at the Armory where hundreds of Nepalese folks came out. And that's because we were able to identify a Nepalese speaking physician, or a couple of them actually, to help promote it and to come that day to the Armory and do translation on site for us. So again, this is all about meeting each specific subpopulation where they are, identifying what they need, and making sure that we're doing everything we can to get it for them. Next, some of you may have seen, we launched a poster contest to help engage our kiddos. Our kids have had a hell of a year, just as much as us adults have. And a lot of the decisions that have been made, they've just had to live with, like many of us, without having much say in the matter. And so we really wanted to engage them and give them an opportunity to put their voice into the vaccination effort, to help educate them about vaccines as well, but to let them put their creativity, their artistic abilities to work, helping create posters and flyers that we will then brand on behalf of public health, and that we'll actually use in communications with the community. So we are doing some gift cards to winners' homerooms for classroom activities. And it's actually been really cool to see the way that a lot of teachers from all of our school districts, and this contest is for all of our school districts, but so many teachers have gotten in touch with us directly to let us know that they appreciate this, appreciate us engaging kiddos in this kind of work. Just a couple more examples here before we move forward. We are also launching a community empowerment initiative, and this is really to get further into partnership with a number of our local businesses, especially small local businesses. So we're excited. We've got a couple of initial businesses identified in the Quindaro area and neighborhood where we'll, again, enter into kind of small monetary amount arrangements and agreements with them so that they can really push vaccines to their clientele, to their neighborhood members, get them signed up, help them know where to go, when to go for a vaccine. And again, these need to be community leaders who are the ones providing this messaging to their own neighborhoods. So very excited about this one as well. And then lastly, we've been doing a lot of business engagement. And I know a number of you commissioners have been in some of these, which is very wonderful and helpful. We've been doing face-to-face meetings. Here you can see on the bottom with over 160 businesses directly, or excuse me, not face-to-face, but one-to-one meetings. So with us and one particular business that has questions or wants an on-site mobile vaccine clinic or whatever it is. So a ton of individual work with businesses. And then we've also sat down a number of times with the chamber. Greg Kindle and his team at YDEC have done a great job pulling together a number of businesses for us on a monthly basis since January, where we've gotten to provide a ton of information about vaccines. We have also presented in recent weeks to Business West and to Fairfax Business Association. So just all that to say, we are doing everything we can to engage every sector in the community that we can to get them on board with our vaccine efforts. Okay, lastly, we get to dive into the health order stuff, the most fun stuff. So originally, earlier this week, this wasn't the direction that we were planning to move. A lot has unfolded this week, including a lot of changes in the jurisdictions around us. And we know at the health department, as well as anyone, that we can't only make health orders decisions based on what we want as epidemiologists and health officers. There's also a massive community input piece of this. There's a political piece of this. And so we want everyone to understand that we are doing our very best to bring forward recommendations that consider all aspects of this very complicated puzzle. The existing health order that we have in place today was signed into action by the commission about a month ago. And this existing order we're all operating under expires on June 10th as it stands. It requires 6 feet of social distancing in public spaces. There are, of course, a number of exceptions. Our current order also requires masks while indoors in public spaces the vast majority of the time. It also requires masks in public spaces while outdoors if you are not able to maintain 6-foot distance for the vast majority of the time. And lastly, you want to make sure people remember that there is an exception in our current order that indoors, individuals who are in the same space may remove their masks if everyone in the room is fully vaccinated. So I just wanted to take a moment and remind everyone what we're currently operating under, as if you're anything like me, there's been a lot of health orders. It's easy to forget what's in place today. So this is what we're operating under right now. As I mentioned, a lot has changed in the last week around us. So Johnson County has moved to recommendations only for their community around mask wearing and social distancing. Kansas City, Missouri, and Jackson County have, within the last 48 hours, signed almost identical public health orders that are a pretty significant change from where they were. So their new health orders for both of those jurisdictions require mask wearing while indoors in a public space, except again for groups whose members are fully vaccinated. Now, the new health orders for both of these jurisdictions do not require masks for outdoor public spaces, regardless of whether or not you can maintain social distancing. And their new health orders also do not require that social distancing either inside or outside. So again, some pretty big changes here. And based off of a lot of the factors that we've discussed with you this evening, including our steady case rate, our continued work to promote vaccines, and our desire to try to make changes that are in concert with those around us, we at this point now recommend that Commission really move to a health order that almost identically mirrors KCMO and Jackson County as well. We do feel at this time that it is not the appropriate step to take to remove health orders altogether. And that's because the mask wearing indoors remains crucial. There are various risk levels, as you all know, after the last year, depending on what activity you're doing. An indoor meeting with individuals outside of your family who are not vaccinated without masks still remains a very risky activity. The risk level for outdoor activity, around others with masks is significantly lower. And so we are advocating tonight that you consider removing the mask wearing requirements for outdoors, removing the social distancing requirements, but maintaining the indoor mask wearing requirements in public settings. This again would closely align with KCMO and Jackson County, and we think it would really continue to impact the most risky behavior around the COVID transmission in our community. We will, of course, or I do, of course, want to continue to remind the community that we recommend folks wear masks regardless of where you are if you're in a public space. So if you were to adopt the order that would remove the outdoor mask wearing, we do want to make sure folks understand we would still encourage you to do so. And that would especially be important if folks choose to opt into large events, large sporting events, large concerts. While it may not be part of this order that you all may consider this evening, we would still want to very much promote and encourage that. And that is all we have planned this evening, Mr. Mayor. I will throw it back to you.
Thank you, Julianne. We have some commission comments. First, Commissioner Townsend.
Thank you, Mayor. Good evening, Ms. Van Loo, Doctors Corvo and Griner. Thank you all. Thank you, all three of you and everyone who is with your staff and supports you in what you've done so far to mitigate the effects of COVID in the Wyandotte County area. I particularly appreciate how you are drilling down to certain segments now of the populace where you see a reluctance for any number of reasons that we're trying to understand people in those particular communities not getting the vaccines. A year ago, we were all, hopefully looking forward to having a vaccine. And now that we have it, it is puzzling that so many are not opting to take it. So I appreciate your efforts to drill down in the particular communities and find out what the reluctance stems from. With regard to the mobile vaccines that will be going around, the mobile vans who will be doing taking vaccines to the populace in particular areas. What type of vaccine will be administered? And what I'm really getting at is, will there be a setup that if the mobile vaccine appears at a particular point on a certain day, that a month later, they will return to that same facility, so persons who have received their vaccine on day one, that 3 weeks or a month later can go back to the same place and get a second dose? Or are you looking at administering the one-shot dose?
Great question, Commissioner. The general rule across the board is that now that they have removed the pause for J&J, the vast majority of our mobile vaccine work will be J&J, precisely for the issue you mentioned, which is that it's a one-dose vaccine. In the event that there are religious concerns or other concerns with that particular vaccine, we do have a great supply of the other two options, and we are happy to work with particular sites if it would make a difference in turnout if we used a different vaccine. And we would, of course, turn around and immediately reschedule either that 3 or 4 week follow-up, depending on the vaccine. So we would never leave folks hanging for that second dose if they got their first dose through us.
Okay, I appreciate that. Thank you. And with the proposals to the current order that you just made note of, when will we be actually looking at the detail on that language?
Doug or Misty, do either of you want to weigh in?
I'll say, Commissioner, if the commission wants to consider advancing this, then we would prepare it and submit it as a second blue sheet, or what we call a pink sheet, to tonight's agenda, and you would be able to see it then. The language is pretty straightforward, so it's not one that's going to take you a long time to read through and see what it is. It basically just puts into action what what Julianne has gone through, should you all feel like that's the direction you want to go.
Okay, thank you. I wasn't trying to hasten it because I understand that the current order remains in effect until the date Ms. Van Loo mentioned in June. So I wasn't trying to hasten it. I wasn't clear as to whether or not this was something we were taking action on tonight. And as recently as earlier today, I went through word for word our existing order. So before I would contemplate anything else, I just wanted appropriate time to compare the actual language of our current order and what's being proposed. I wasn't trying to hasten it, just to be clear. Thank you.
And Commissioner, I'm just pointing out that based on where the commission wants to go, we would be ready to go now, recognizing the other jurisdictions have moved, or we can wait and consider it in a week, or however you want to do it.
Well, so that the mayor won't have to recognize me again, and based on what you were saying, I'll just say, I, for one, based on the numbers that Dr. Corvo and Dr. Greiner have shared with me and the provisions we already have in effect for our current order, I, for one, am not in favor of relaxing it at all. I think if we do that with the low numbers, we're not doing ourselves or our populace any favors. The numbers, in my opinion, that have been shared tonight just don't support doing anything more than what our current order allows for, which probably was more lenient than what the other jurisdictions discussed tonight had. So I am concerned still about people in the zip codes that comprise District 1. And if those individuals become ill for any reason, COVID or any other, it always presents more of a challenge medically and economically. So I for one, believe that we are in a good place with the exceptions already carved out until the numbers of those completely vaccinated rise. So that's my 2 cents or a quarter. Thank you. Thank you again to the health department and everyone that is supportive of the health department that works there that are not present tonight.
Thank you, Commissioner Ramirez.
Thank you, Mr. Mayor. And as this will continue to be until we are out of this, but thank you, Julianne, Dr. Corvo, Dr. Greiner, and all of the health department employees who have gone above and beyond of what they can do and of what they've had to do for this entire year, and sacrificing many hours and just working hard to keep our community safe and protected. I can't thank you enough. My district cannot thank you enough for everything you have done and continue to do. I will say that I'm contemplating on the way forward with the health order for the repealing the outside requirement, but I do not support repealing the indoor requirement until I believe, as Commissioner Townsend had said, until our vaccination rate increases. And once that happens, then maybe we can look at possibly repealing the indoor mask removal. But at this time, I'm still thinking about the outdoor one. I'm still contemplating that. But just overall, to those who are watching or those who will watch this in the future, if you go back, last year, it was a painful year for all of us. We lost family members, friends, and colleagues, but our governing body and our health department have done their part. We did our part by setting up the infrastructure to monitor and mitigate COVID in a community. And now it's time for the community to do their part. It's time for you to help us by becoming vaccinated. Growing up, I was taught when you do something, you do it right and you finish it. The Unified Government Public Health Department started this, and I believe that they are doing it the right way, but your time now is to help them finish it. Help us get back to where we need to be. Help us get back to a normal life. Every decision we've made, every decision the public health department has made has been based on data. And it's because we care. They haven't made it political. This governing body hasn't made it political. You know, every commissioner and the mayor on here, we're all Wyandotte Countyans. We don't care about the red or the blue, the left or the right. We care about you and your health and safety. So I plead to you and highly, highly encourage everyone to go get the vaccine so that we can start to go back to our normal lives and restart our community. Please, I ask my community, my district, and everyone that resides in Wyandotte County to do their part. Thank you.
Commissioner Bynum?
Thank you, Mayor. I've got several questions, some of which have come to me, and I'm sure other commissioners, in emails from the public. And I want to ask them and put them in front of our health department experts. And I would like to say, prior to my questions, that I'm in support of the recommendation, and I'm in support of it as a blue sheet item on tonight's agenda. But if we could go back to the slide with the vaccine data, please. My question.
A little more specific, Commissioner, sorry.
You have a slide that speaks of the percentages of folks that are vaccinated. That one's fine. This data, does it represent only shots given by our health department?
No, ma'am. This is anyone who listed wherever they get vaccinated. If they listed a Wyandotte County address, then they are included in this metric.
Okay, thank you. So this is no matter where I got it. If I got it at Walmart or Hen House or any of the number of places in Wyandotte County, or if I got it at work because I work somewhere else.
Yes, absolutely.
Okay, thank you so much. I wanted to clear that up because I think that some of our public believes this number might be just those shots we've given. So that is a cumulative total of everyone.
Correct. We've administered 70% of these, but this is the entire total.
Okay. And kudos to you, by the way, for continuing all of the hard efforts you're doing to get folks vaccinated. We're going to do all that we're capable of doing to help you. Is there any contemplation on the part of the health department to allow the 3 different cities in Wyandotte County to determine their own masking fate?
That would not be the recommendation of the health department at this time. We understand their frustration and that they operate in some ways as separate jurisdictions, but as a countywide health department concerned with the health of the entire county, there is so much fluidity, there is so much movement. I'm not telling you all things you don't know. It would not be our recommendation for them to be able to move forward and remove all masks or all social distancing on their own. It just doesn't make sense epidemiologically, unfortunately, to do so. Dr. Corvo or Dr. Greiner, would you like to weigh in on that?
I just want to second what you have said, Julie, and I think that it is important for us to move together as a county.
Thank you. It was a question that had come to us in an email, so I wanted to allow you to respond to it. Another email that we received was from a gentleman who I think has purchased some season passes to our new Kansas City Monarchs games. Of course, requesting that the mask requirement be lifted. Now, if we were to adopt your recommendation, then that would be a scenario where masks would not be required, correct? Because it's an outdoors venue?
Correct. The owners of that establishment would be allowed to enforce mask wearing if they so chose, but no, as a county, they would not be required to do so.
Okay, thank you so much. My last question, and I'll turn it back to the mayor. I see a lot of commentary from folks who say things like, why do you care if I get vaccinated if you are vaccinated? Why would you worry about me if you are vaccinated? And so my general question is, please, for the sake of our community's understanding, speak to the concept of why we want everyone to be vaccinated. Thank you.
I will kick it off and allow the docs to chime in. The one that strikes home the most with me as an individual is the fact that there are so many folks in our community who are immunocompromised, who have received some sort of transplant, and many of whom who in fact have gotten vaccinated, have had antibodies drawn, and have not mounted an immune response because of their physical health condition. So there are people in our community, a lot of people in our community with illnesses who either cannot get vaccinated or can get vaccinated but aren't mounting that immune response. And so this is for them. This is also for our kiddos. Our kiddos can still catch COVID, and our young kiddos cannot get vaccinated. So this is absolutely about more than us as individuals. This is about protecting one another. We cannot all get vaccinated at this point, and so it is our job to support the health of one another in our community. Dr. Corvo?
Yeah, I think that's a great point, Julianne. Again, we still don't quite understand fully how the spread of the virus is impacted by the vaccine itself. So why does it matter? I may be vaccinated, but still be able to carry COVID. So it really is for that individual who doesn't have the vaccine. Why would you want to be around me without a mask? I mean, it's important if you're not in the same household, to mask up. It really, really is. So it's just a risk, I think, that isn't worth taking at this point with these variants. We're continuing to see widespread circulation of the variants in our own community, but also elsewhere. We've seen them catch fire in other parts of the world and other parts of the United States. So it is out of caution that we think that that's the right thing to do at this point. Dr. Greiner, do you want to add anything?
Yeah, I mean, the only thing I'll add is that, the virus stays around until we get enough people vaccinated to essentially let it burn itself out and go away. And many of you are familiar with polio and smallpox. I think I'm the only one from the health department that's old enough that got a smallpox inoculation, but it took decades to get those diseases to go away in the United States, because if you don't get enough people immunized or inoculated, it will stay around and keep smoldering along, and that always puts people at risk. And we want to do what we did with polio. Essentially, it would be my answer to that question of why do you care if I get vaccinated if you're vaccinated? It's because look at polio. It's simple analogy.
Thank you. Commissioner Philbrick?
Yes, thank you for everybody else's questions. That took care of about half of mine, and I so appreciate that. As usual, there is an advantage to waiting until other people ask a lot of questions, especially when you're working with such smart commissioners. So back to the data thing. For instance, I was contacted and this gentleman wanted to know right along the same lines of, well, my wife got her vaccine in St. Joe, Missouri. Okay. How long does it take for us to get that information that she was vaccinated, or do we?
great question. The Missouri data we've just actually received access to. So Doug signed a data access agreement with us and the Missouri State Health Department, who owns that data. So we now are able to view folks who reside in Kansas but got vaccinated in Missouri.
And when did that happen, Julianne?
Literally just last week or earlier Monday, perhaps. My days run together, but very recent.
Okay, so now we can get that data, and that rolled into our data yet?
I think we're still working on it. We don't, it's actually quite a small number. It's a smaller number than I imagined. So I
Okay.
can report back out on that, but it's nothing that is significantly changing our percentage by any means.
Okay, well, the reason I'm asking, of course, is because we have a lot of people that go back and forth across that state line, and we are in, a metro area. So that was something that I really wanted to know. And I can understand wanting to open it up for the outside folks, for people that are outside, not having to wear masks, that sort of thing. I'm a little leery, but I understand why. So to me, this is almost like a trial. How is this going to affect us? What's it going to do to our numbers? We open it up and what's going to happen. And so how long do you think it'll be before we know if this affects us in a negative manner, opening up to the outside, no mask thing?
I'll let the doctors weigh in as well, but I think the same as we've been talking about throughout the pandemic and every health order change we've made, which is that we need about 3 weeks, ideally 4, to really see if we're starting to tick up or down based on a decision we make like this.
Well, I know we've all talked about this a lot of times, but not everybody's been on here listening to us all the time, Julianne.
Fair enough.
I ask you guys to repeat yourselves a lot, because this may be the first time somebody's listening, and I would like them to hear what you're saying. So it could take up to 3 weeks, and that's from day one. And so even, longer, maybe a month to 6 weeks before we really know what opening this up is done. Is that a good guess, Dr. Corvo, or what do you think?
I would say that within a month, we'll have a really strong indication if there are changes and our numbers are going the wrong direction. I think even within a couple weeks, we'll start to see a trend. But yeah, so.
Oh, okay. Yeah, I really appreciate your answer. Thank you so much. That's it.
Commissioner McKiernan.
Thank you, Mr. Mayor. 3 brief comments. First of all, to echo Commissioner Ramirez, to Ms. Van Loo, to Drs. Greiner and Corvo, thank you to you and your staff for all the hard work you've done over these past now 14 months, 15 months. I do think there is light at the end of this tunnel. Having said that, everybody, please go get vaccinated. And the third comment is that I am in favor of modifying the health orders immediately to be in line with Kansas City, Missouri, and Jackson County. Thank you.
Thank you. Commissioner Townsend.
Thank you, Mayor. Going back to the reference to the ballpark that Commissioner Bynum brought up, sorry. My reading of our current order would allow for the mask to be removed currently if that gentleman could maintain 6 feet of distance. And I'm referring to section 2 of our current order that talks about being able to remove the mask while outdoors in a public space, as long as you're able to maintain 6 feet of distance. So I guess my point is we already have an allowance for that. And the recommendations, as I understand them, would also do away with the 6 foot distancing. So I think if we're talking about removing masks and removing the need to social distance, I think we're putting ourselves on a backsliding situation that we can ill afford at this point. In my opinion, the things that people want to do, we can do currently under the order. So I would just go back to reading the order, encourage people to read the order so they really understand what we can do now. And as Commissioner McKiernan said, please get vaccinated. Thank you.
Commissioner Walters?
Thank you, Mayor. I want to echo everybody's compliments to our health department for bringing forward all this information. And I also support this revised recommendation and hope that we can implement it immediately at tonight's meeting. I do have a couple questions. And my first question is, with full disclosure, I look forward to the day when we will eliminate the masks altogether. And I've always been trying to figure out how we will know when the right time to do that is. But I've heard this 70% number, and the information that you provided here tonight, you said that 21% have had full vaccinations, 28% have had one dose. Is that of all residents of Wyandotte County, including children?
Correct. And let me skip back because we also showed a quick graphic for those who are eligible. So for 16 and older population, which is our eligible population right now, 37% of those folks have at least one dose.
So that's the number that you would love to see at 70%.
Yes, although fair warning, our denominator will continue to change. So when we move to 12 to 15-year-olds being eligible in June, we'll continue to have to make up those percentage points to stay where we were, if that makes sense.
Sure, it does. And the 70% does sound very ambitious. The other question I had was on the exact wording of the new guidelines, and it says masks to be worn indoors. But you gave us an example of Kansas City's ordinance, and it was talking about places of public accommodation. So will our ordinance literally say masks must be worn indoors?
If you do want to pull, no, my apologies if I misspoke, Commissioner. It is intended to mirror KCMO in that it is public settings where the mask would be required indoors.
So that's places that are open to the public?
Yes.
So a private business that's not open to the public would not have to have this requirement?
I'm going to throw that to Misty over in legal.
Thank you, Julianne. This is Misty Brown in the legal department. What I had done when drafting this is we did copy almost verbatim what they did in Missouri and Jackson County, and it was all employees or visitors to any indoor public accommodations. So that's a good question. I think technically if it was a private place that was not open to the public whatsoever, then probably technically they would fall outside of the scope of this ordinance.
Okay. And the second exception, of course, is if everybody's been fully vaccinated, right?
Correct. If you were in an indoor spot and you knew that everyone had been fully vaccinated with you, then you could remove the mask.
Okay. Well, thank you for that clarification. And again, I support your recommendation. Thank you.
Commissioner Bynum?
Thank you, Mayor. Just to clarify, the gentleman who had emailed me and I think several others about the Kansas City Monarchs games had indicated in his email that he was told by the Monarchs that they were told by our health department that the masks would be required. And so I just wanted to clarify that. So if that's not the case, that's perfectly fine. That's why I'm saying it out loud here. But certainly under new health order, again, it wouldn't be required there. So that's it. Thanks.
Commissioner Markley.
Thanks, Mayor. I just wanted to express that I am in support of the recommended change and that I would be willing to consider that on tonight's commission agenda.
Commissioner Johnson.
Thank you, Mayor. And what a great and lively conversation we've had tonight. Again, to Julianne, Dr. Corvo, Dr. Griner, the work that you all have been doing is just words cannot describe. And I don't think the average person that even listens in to these conversations really can appreciate the magnitude and the depth of work that you all and your staffs have done. And so for that, I just want to continue to express appreciation to you all for what you do. I am thankful that you all have heard the voice of the community, as well as myself and others that have said we've got to be more engaging with the community. There's been a critique that there are persons that cannot get to the vaccination sites. And in that regard, we have answered the call again. And it seems that every time someone throws up some reason why we can't address this issue, you all do everything within your power to address the issue to the best of your ability, and with limited funds and with all of the other obstacles that are facing our community. At the same time, and I think you all would agree, I find myself held in great tension, because on the one hand, and it cannot be overstated enough, we are still in a pandemic. And, while the statistics may be, shifting one way or the other, trending one way or the other, we are still in the midst of a pandemic. It is not over. The idea of us getting to, the end of this year or getting into first quarter of 2022, until we see some level of whatever normalcy might be, that does not strike me as odd, or does not strike me as something that should be frowned upon, because of the fact that we are not only in a nationwide pandemic, but a worldwide pandemic. And so again, I find myself held in tension, because on the one hand, we're in pandemic, but on the other hand, now we have more supply than we have demand. And so it's not just because persons don't have access to be able to get to the vaccination sites, i.e. via transportation, et cetera. It is because there is still an apathy that is within our community as a whole, as it relates to the necessity and the need to get a vaccine. And that is where I think I tend to start making my decision, because I don't want to harness or to hold the entire community at bay when persons have the ability to be vaccinated and choose not to be. And that then has an effect upon our percentages as it relates to vaccination. And yet we are continuing to push in every way that we can. And the screen that you showed that did it for me was the fact that now, in terms of 66102, 66101, and 66105, we are starting to see similar rates of progression that we see throughout the community at large, which lets me know that we are moving into those areas that had been previously underperforming. And so again, I would say that I am moving towards supporting the new health order. One, to be as in terms of being a regional participant, because we have to continue to remember, though we have state lines, though we have rivers and things of that nature, we are still one KC. And so what affects Jackson County affects Johnson County, affects Wyandotte County. And so again, I would side towards moving forward with the recommended changes. Thank you, Mayor.
Thank you. I'll just offer a few comments and then pass it on to Commissioner Philbrook. But we continue to hear this debate about whether this is how we handle the pandemic ought to be handled by governmental action or by personal responsibility. and certainly personal responsibility has to be first and foremost. However, what we've seen is there has been a tendency, because this is an uncomfortable situation, and there has been a lot of, we ignore the pandemic, we deny it, we strike out against it, and then we strike out, frankly, against the health department and governmental bodies that are trying to stop the pandemic in the interest of public health, which is their role. That is their job. That's what they should be doing. And I try to put this in context, and I try to tell the story that at the onset of the Second World War, in January of 1942, after the attack on Pearl Harbor in December, German U-boats popped up on American shores and began to take out shipping that was providing coal and fuel oil and other supplies, food and other supplies to our allies, specifically to Great Britain. And they were so successful that they were wiping out more shipping than we could replace. And that continued on for about 6 months. In fact, the Navy kind of hid the facts of the lost shipping, and local reports would report it, but it didn't get any play nationally. 5,000 sailors died during that 6-month period. One of the things that shocked the German U-boat commanders was when they arrived on our shores, they could clearly see the outlines of the ships because of the lights that were left on in our cities, street lights, car lights, building lights. And it wasn't until July of 1942 that there was an order requiring all lights to be turned off in any harbor city. And that was simply to protect shipping. So it was basically a public act required by government, enforced by government, to make sure that we protected our shipping. I think we're doing the same thing during this pandemic. And the reason that it was given why we could not do a blackout order was because it would have hurt business. And in fact, it destroyed business, because if you're not confident that you're going to be able to defend your shores, you can't really conduct business. So again, I'm going to point out that if you do studies have shown that if you have a jurisdiction that has orders in place and adjacent to a jurisdiction that does not have an order in place, the difference in business activity is only about 10%. And that is because individuals are deciding that it's not safe to go out. They don't want to get out because they don't want to catch the virus, spread it to their loved ones. So this false narrative that government is oppressing us in the pandemic, we've got to get beyond it. It's simply a way for us to come together and empower our officials to do what is necessary to protect everyone, our loved ones, our employees, our customers, from this pandemic. And I will support a change in the order. Commissioner Philbrick.
Thanks for taking another question from me. So this is for Dr. Corvo. Question about, so I had already asked you, did we get the information from somebody in Missouri, when they got their shot? And then if it's a 2-shot situation, then we'll be notified again that they got their second shot, right? Okay. Now, having said all that, there are people out there that think their individual rights to anonymity are being affected, and maybe there's a HIPAA issue around this. And would you please explain to folks out there that their HIPAA is not being violated because they're dealing with a whole bunch of health professionals? Go ahead, Erin. Appreciate it.
Well, yeah, it's an interesting question, Commissioner. Thanks for bringing it up. I agree with you that I don't think that HIPAA is being violated. It's in fact not. This is not a strange practice by any means. We certainly have requirements to enter vaccine data into state systems all the time for all of our school children, and all of our clinics do this regularly and such. And so I'll just say that's the case. I also want to make the plug, that if you received your vaccine in Missouri or at another facility, we're happy to give you your second shot. Just bring your card. And we'll get the information entered in there. Julianne may want to add something to this, or Dr. Greiner.
Their heads are shaking now. So, and And I do want to echo what Mayor Alvey was saying about it's all of our duties to help each others, because even the percentages are, even those of us that have had all of our shots, there's the 5 to 10% in that. That means, like you said, I could be a carrier and then I could carry it to my patient, which then they take it home to their family and their mom or dad or somebody gets sick. So every day, being in the healthcare field, my office is constantly being cleaned. Everybody's wearing masks. They're washing their hands. You don't get in the door without a mask. And that means nose and mouth covered, because I don't want to share it with anybody and I don't want to make anybody else sick. So I figure it's my responsibility to help take care of others so they don't get sick, and try to encourage all of them to get their shots. So that's my challenge, Wyandotte County. Get off your duffs and get your shot, will you? Join the old broad and do that. Thanks.
Commissioner Bynum?
Thank you, Mayor. It's my last question. With regard to the recommendation on modifying the health order, when we allow for mask removal indoors when all have been vaccinated, I'm going to have to say that's going to have to occur on the honor system, correct? I mean, we're not going to have any enforcement capability on that.
Correct.
So if we go to a meeting and we all look at one another and say, we've all been vaccinated, let's take our masks off, that's kind of the end of the conversation. Wouldn't you agree?
If you trust those people, I would agree.
Okay, thanks very much.
Commissioner Burrows?
Thank you, Mayor. And I would like to thank my colleagues for their round of questions. It's been quite interesting to listen to the concern. And I too am supportive of having the recommendation advanced this evening for discussion by the full commission. If I may, I do have a few questions. One of them being the information that has come from Kansas City, Missouri and Jackson County. What percentage of those have been vaccinated in their communities? Do we have a percentage of those that have been vaccinated from in Missouri in those particular areas as to why they would lower their mandate?
Dr. Corvo or Griner, have you checked it? I haven't checked in the last couple of days. Last I checked, they were very close to us, maybe a percentage point or two ahead of us, but very close to where we are. Whereas Johnson County is a good 10 to 15 percentage further than we are.
I was going to say that I agree that last I checked, Jackson County was a bit ahead of us. I'm less knowledgeable about KC-Mo.
And I appreciate that. And the reason why I ask is I think it's important to be mindful that we started out with the core four. And if I'm wrong about the core four, please correct me. But I do remember we were trying to have a metropolitan uniform policy so that there would be limited confusion. And I believe what we have now is a fracture, and we are seen as the outlier. And while I don't regret being an outlier when it's of much benefit, I look at the numbers on the map by zip code, and I see in the western part of the community, as well as the southern part of Wyandotte County, we are meeting the criteria, and there's more vaccine being administered and or more compliance in reference to the mask mandate. And so the strong recommendation that was made by Johnson County today, it's not lost on me that the border community to the south is a community that can very well not only suck the wealth out of our community, but can also not come into our community because of this overshadowing mask mandate. They are going to a strong recommendation without enforcement. Is there any consideration to considering a strong recommendation and allowing the local cities, and I think this goes back to Commissioner Bynum's question earlier on today, or this evening when we started this discussion. Has there been consideration to a strong recommendation and then allowing the city leaders, those that were elected to lead their communities, make that decision individually?
At this point, we would not make that recommendation. I would remind folks that although those couple of zip codes out west are further along in their vaccine numbers, they are nowhere close to herd immunity either. And so there is still significant community risk of indoor settings, maskless in those zip codes as much as elsewhere in the community.
And Julianne, thank you for that comment. It's the purpose of asking that question is I frequent those businesses that respect my health. And if I arrive and there's a mask on by their employees, chances are I'm going to do business with them. And I do respect political differences, religious differences. However, personal rights stop where others' rights start. And I think that's some of the issues that we're dealing with. And I've struggled with this as an elected leader that, and we're seeing it on the state side where there's some overlap in who's dictating who can do what in the particular area that someone else has been elected to represent. And so the strong recommendation that Johnson County put forward, I'm just kind of curious as to why we would not even consider a strong recommendation and allowing our local cities, those that within our borders, to have the option either to opt in or opt out, especially those that border the Johnson County corridor.
I wouldn't say we haven't considered it. We have considered a range of options from almost nothing to maintaining what we have now, which is a fairly robust health order. The way people move about in our community, in our minds, it just doesn't make sense. You can't keep people confined to their zip code. Yes, there's cross-jurisdictional boundaries that are crossed all the time. We just don't have jurisdiction there. We only have jurisdiction over our county. And so for our county, this is what we think makes the most sense. Dr. Corvo or Dr. Greiner, I don't want to speak for you.
I mean, I'll just chime in here to say that, sometimes in all this discussion, we lose the fact that we have a ton of evidence now in the United States that masks and social distancing made a huge difference on controlling this pandemic, especially at points in time when people in the United States got scared and they started changing their behavior. It's very clear these things work. They are an intervention that works. And so you can see that we're trying to work with the core four and trying to be consistent, but we've also got to keep in mind what actually works from a scientific perspective. And I think that in public health, if we can save lives, we're gonna try to deploy an intervention that works. We're trying to accommodate stuff, but we've got to keep that in mind as well. It's a real balance, and it's tough, I think, for you guys and for all of us.
And Dr. Greiner, thank you for that. I think it's important that those that may be listening tonight understand that we're looking at data, and it's been mentioned through some of the other questions. I will just state this, that there's adequate vaccine available. There were those of us in elected bodies that reached out to the state and from the state to the feds to get the vaccine availability and doses up into Wyandotte County, and they are here. So those that have refused to get vaccinated for whatever reason, whether it be political, religious, or just not having the ability to get there, we now have accommodations for that to occur. And I, like my other commissioners, just want to state publicly, if I may, that please, by all means, we are a community, and it's best that we all take our personal health and the health of our friends, family, and neighbors seriously if we are to move forward and to find some sense of normalcy after this pandemic. So with that, I appreciate my fellow commissioners and allowing me to ask these questions. Mayor, thank you. But more importantly, I sincerely want to thank Dr. Greiner, Dr. Corvo, and Julie Van Loo for their commitment to the health and welfare of our community. So again, thank you everyone for allowing me to ask the questions.
Right. Thank you, everyone. Excellent discussion. The sense I have and listening is that we will bring blue sheet item forward to the full commission meeting. At this time, we'll move on now. Thank you, Dr. Corvo and Dr. Greiner and Julianne. Next topic, Mr. Bach.
Thank you, Mayor. And we will move forward to prepare the blue sheet for the 7 o'clock meeting tonight. Next is a follow-up to our CMIP project meeting last week. We were able to go through it. We concluded that project. Commissioners had a few different questions, some requests for some follow-up on specific projects that were listed. So tonight's agenda, if we're able to get through it, if not, we'll be moving forward to a budget workshop next week, and we will continue at that point. But there was information about the crime lab from the police department that we had built into the budget, the radios system, the radios, how they work, and the CNET process were a few different process points that were specifically asked about. Commissioners also asked about the unfunded project list. We were able to submit that out to you earlier this week, so if some of you were able to look through that, but we'll also have that on the agenda to go through tonight. Specifically, as I noted last week, I'm looking for direction that gets us where we're going for in 2022. I recognize there are a lot of projects out there from 23 and beyond, and we will continue. There is an infrastructure task force or committee that's going to work on how we're looking at different things for funding, and I think that provides some room as we look at those, but this does lay out the plan for those future years, though we can adjust those year to year. But this gives us our emphasis for what we're doing now. Also, I will just say regarding revenue, we are building this at this point, and we could see some differences, but revenue is based on a flat debt line. We're not increasing our debt. And if that's a direction the commission wants to go in a different way, we can add more to our debt, but we have done it based on that. And as you know, most our projects are funded under the debt area. And from a cash perspective, we're building it like we did in 2019 with a little bit of inflation built into it. I think next week when we get into the budget workshop, we'll see that we are looking at a little bit improved revenue forecast, but you'll also recall that we were looking at a $5 to $6 million deficit on our annual basis. So we weren't assuming any major change from where we were in our last, in our cash outlet. So with that, I'm going to move into the presentation. I'm going to recognize Colonel Vivian, I believe, with the police department, who's going to lead off and talk about the crime lab. Colonel?
Yes. Yep, I'm here. Can you guys hear me?
Yes, we can.
Okay, great. Yeah, so we refer to it as the crime lab, but I just want everybody to know that it's the crime lab solely for the purposes of our CSI technicians. It's not anything where we're going to have KBI personnel working out of there or anything of that nature. So maybe if we think of it more of the CSI workspace, maybe that might be a better description of it. But it does contain a lab where they do their work, and the primary benefits that we would see out of it is, their workspace would triple in size. And the lab is probably, for them, is probably the most important aspect of that. Right now, we can only have, one technician working at a time in there. And so they do that primarily so we don't have cross-contamination of evidence. But that causes, some issues, obviously with efficiency, with getting our evidence packaged. The types of things that they'll do in there is the evidence packaging. If there's items that they need to swab DNA from, they'll do that. They'll lift latent prints from items. It's where the drying cabinets are. If we have bloody clothing or bedding, things of that nature. That's the type of work that the CSI technicians do in there. But only one technician can work at a time in there. Then they have to clean up and prep it for the next technician. And I will tell you, there are times where there is a lot of evidence that is just stored in there that we have on carts, just waiting to be processed and packaged and put into our logistics unit. It's not optimal. And with the new CSI lab, we could get at least 2 very easily, and it looks like three technicians working at once. So some of the issues that we see with that with the current space is it does increase our overtime. We require that felony evidence on violent crimes be tagged that night, if at all possible, when they recover the evidence, because we obviously just don't want it sitting, out, even though it's in a secure location per se. It's definitely not optimal, and it's definitely not the best practice as designated by the IACP. So that's one of the big issues. I think that's obviously a big benefit to the, from my perspective, to the community, is that we'd be stepping up and doing, a best practice as far as evidence goes. I mean, we're talking about evidence that would, convicts people or exonerates people, and we need to keep that as clean as possible. So I think that's a huge benefit for the CSI technicians and the community, obviously. Having the CSI lab attached to the tow lot, another benefit that I think we would see is a quicker turnaround time on getting vehicles processed. Captain Wallace, God bless him, he talks to people every day because he's in charge of auto release. People that are upset that it's taken, a few days to get their cars back. I think we'd see that process ramp up, probably next day at the latest. The community members could expect to get their cars back, unless it's something that we absolutely have to hold on to for court purposes. So I think those are a couple of the biggest benefits that we would see out of the lab. And I'm certainly here to answer any questions that you guys have about the lab, or the workspace, which I think is probably a better term to use for it.
Thank you, sir. Are there any questions or comments? The only question I would have is, do we anticipate that this would necessary? I think what I understand you saying is, you're working in cramped space that's not really adequate. It would be better to get into a better space. Are we seeing that crimes are not being solved because of the space we currently have?
No, I wouldn't say that. I just think that we are tempting fate by continuing to work in this manner, to where I think, the CSI technicians, they do a great job. They work hard to keep everything orderly and clean down there. It's just, I think when we continue to work in this manner, and we've been doing it for years, I think, obviously the, possibility of something, unfortunate happening with some cross-contamination of evidence is going to, eventually bite us, is what I fear. And, we don't want that to happen. It hasn't happened yet so far, but I think we can only push that, so far.
Thank you. Commissioner Philbrook?
So I want to say thank you, Mr. Vivian, for sharing your comments, because I used to work for the city a long time ago down at our lab, down between the digesters. And I tell you that, we all did only our jobs, and we had our own areas. And staying up with and keeping an area immaculate in a lab and to stop cross-contamination is really difficult. And hearing that your folks have to clean up between each person coming in, you lose a lot of time that you can actually be processing information. So thank you for sharing that.
Commissioner Ramirez?
Thank you, Mr. Mayor, and thank you, Colonel, for coming. My question, I believe you may have answered it, but just for clarification, has there been any instance of cross-contamination?
No, we haven't had none that's ever been brought to our attention by the district attorney's office or anything of that nature. So far we've done a really good job. We've been here now about 16, 17 years in this space. So, we've done well. I just don't want to keep tempting fate.
Mm-hmm. And thank you. That's understandable. And thank you for all that you do, and for the lab thank you for all the lab does. Thank you.
Thank you.
Commissioner Burrows?
Thank you, Mayor. Colonel Vivian, a couple of questions, if I may. Will we still be utilizing the KBI crime lab at the Kansas City, Kansas Community College? Because my understanding is they do ballistics as well as DNA.
Yes, they do the ballistics and the DNA for us at the community college. everything else that we need KBI to do for us. And KBI does about 95% of all of our evidence testing, and there's no charge to us for that. Everything else, question documents, or sometimes we'll have them do latent prints, things along those lines. All that other stuff goes to Topeka. But yes, we'll still be using that lab. Nothing will change at all with that.
Has there been consideration to partner with them and bring them and the additional resources they may provide into the lab being designed with the tow lot?
I don't know. We really haven't, just because looking at the space that we have enough office space for our 9 CSI personnel and a captain and our latent print examiner. And that's kind of where we're maxed out as far as personnel space. So that would, I think we'd have to increase the space for the office. And I don't know that would be something that would happen anytime soon. But, if it does happen in the future, then, if we could increase it, then yeah, that would be great to do something along those lines.
Well, great, thank you. And Colonel, it was the bill that I introduced that brought the KCKCC location for the KBI crime lab into Wyandotte County to ensure that we had ballistics as well as DNA to address the backlog that was at the KBI, as well as the amount of shootings and weaponry that was being discharged in Wyandotte County at the time. So I guess at that time, we didn't have what was considered an accredited lab to do our evidentiary material for court. And my next question would be, you talked about best practices. Will we be an accredited lab at this time once we put the lab into play?
The lab won't be accredited because it's not technically a lab. This is just more of a workspace. We don't do any of the comparison of DNA ourselves. We don't do any of the comparison of shells to firearms or shells to shells comparison ourselves. So no, in that regard, our latent print examiner, yes, who does the fingerprint comparison. But the lab itself, no, because that's probably why I say we should probably refer to it and think of it more as just a workspace, a CSI workspace.
And I think that's a fair analogy. So what we're talking about, you talked about earlier, evidence integrity to be presented to the justice system. When we present that information, will it compromise us not being an accredited lab when we bring that information forward?
No, as long as we're following the best current practices, we will be fine.
Okay. One more question, if I may. The cost savings versus cost avoidance is, I'm looking as a member of the community, I'm strongly supportive of a KBI, or CSI lab for our police department, a more modern facility to allow not only the additional workspace, but the quality of the work and the integrity of the work. And if this will allow us to accomplish that, then I'm quite supportive. I would just hope that we would consider, if not now, in the future, as I have espoused over the last handful of years, to partner with our local KBI for a larger facility in Wyandotte County, because I have had those discussions on the state level, and they are willing to partner with us to ensure that we have a state-of-the-art lab that will allow us, one, to grow our own technicians, whether it be a ballistics, and we all know how competitive that field is, as well as our own DNA testers, and talk about the integrity of the serum and those blood products that are needed for cases. So I think this is a tremendous opportunity for our community. I would just hope that we don't shortchange you in your request just to get the lab.
Yeah, no, I think that's a great idea, and I'd love to be a part of those conversations with whoever we need to have those conversations with.
Thank you, Mayor. Thank you, colleagues.
Commissioner Townsend.
Thank you, Mayor. Good evening, Colonel Vivian. I am not at all familiar with what is actually done at the current CSI lab space / workspace, as you called it. So if you would please just tell me what is currently done there, how many people do it, and what would change with regard to the performance of tasks in a new workspace, if that was brought to fruition?
Okay, so we have 9 CSI technicians, and just kind of give you an idea of, say they run a call, say there's a call of a shooting. CSI technician would run out to the scene. They'd meet the detectives out there. They would process the scene. They would gather all their evidence that they're going to collect, whether it's shell casing, some bloody clothing, DNA swabs from blood, at the scene. They would package all that at the scene in its initial packaging, put that into the CSI van, and come back to the office. So once they get back to the office, then they go into what we would refer to as the lab, but let's call it the workspace, and take that evidence in there. And from there, they need to separate the evidence. They need to, if they have bloody clothing, they need to put that in a drying cabinet, but there's only one table, stainless steel table, for them to work on. So in the meantime, we have other CSI technicians out on other calls. They come back. Obviously, the room's occupied. They have their evidence. So now it just starts to cause a little bit of a backlog, a backup, because we can only have one person in there at a time. So it might take that first CSI technician a couple, 3 hours, maybe longer, depending on the size of the crime scene and how much evidence they recover. So the other, 2 technicians that are working on that shift, they're out in their space where they have their cubicles, and they'll, be working on reports, but they can't really get fully into their reports because they can't note in the reports what they've done with the evidence, how they've packaged it, and all that stuff. So there's kind of like downtime, if you will. So that's where the efficiency part of it comes in. That's, one of the biggest things that we would see. In the meantime, if additional calls are coming in, we've got 3 technicians working, 2 of them are sitting there, and the room's not open because the other technician's in there. They have to go out and answer those calls, bring back more evidence. It kind of compounds the problem. So in that room, the primary things that the CSI technicians do are the final packaging of the evidence, the drying cabinets for the bloody clothing, the bedding, things of that nature. If they come back in there, say they've recovered a gun at a scene and they're going to swab that for DNA, they'll do the initial DNA swabbing with the Q-tips of various items. If there's evidence that they bring back that they're going to try and lift fingerprints off of, they'll do that in the room. They have their super glue chamber, another method of recovering fingerprints, that's in there. So those are the primary things that they do in that workspace. And then they package it all up, and then it goes across the hallway into the logistics unit where it's stored until it's needed for court purposes or gets sent off to the KBI lab for additional testing. And then once they, have gotten it all packaged and over to logistics, then they clean the room, sanitize it, and then they move out, and that's when the second person can come in and get started. So that's kind of how the whole process works, in a nutshell.
Thank you. With regard to some of the processes you just mentioned, if you have one technician already in the workspace area processing evidence and another comes in, you say that second person has to wait in their cubicle area with the evidence they may have collected from a crime scene?
Yes, they have a table in their cubicle area, and that's kind of where they will store their evidence, waiting to go into the lab workspace, the workspace.
Okay, and at that table for that second CSI technician, the evidence collected waiting to be processed in the workspace area can be locked away or secured somehow?
Well, it's behind a secured door to get into their entire office area. So it's behind a secured door. It's not accessible by, anyone from the public or anything of that nature. You'd have to have an access card to get into the office. But there's no lockers. There's no room for lockers out there. We do have some lockers. They're small. I mean, they're like, you might be able to fit a pair of shoes and, a small bag in there, some things of that nature, but those are in where the other technician's already working. So there's just no room in their cubicle area, if you will. So that stuff has to stay there with them on the table In the best case scenario, at least one of the other two technicians can stay there if one of those two technicians has to run out on another call. So it's a juggling act. I'll put it that way at best.
Thank you. And if a new CSI lab/workspace was to be created, how do you foresee that process you just described changing in terms of being able to have more than one technician work in a space and more than one technician being able to secure evidence collected before they can work on it, say drying it, swabbing and all that type of thing?
I'd say in the lab workspace area, that's going to triple in size. So I would say that looking at the measurements of the room and the stainless steel tables that we use, we can easily fit 2, and it looks like 3 would fit comfortably. So it looks like we'd be able to fit 3 technicians in there working at their own separate workspace inside the little lab workspace. And there's an additional room where there are lockers. So if one, say they had to come back and they, as soon as they get back, they get called out on another call, they'll be able to lock up the evidence that they just collected from the scene and brought back. They'll be able to lock those up in lockers and then go out on, their second call, collect that evidence and come back, and then they can lock that evidence up, get their first stuff out and start packaging that and doing what they need to do. So it would, we wouldn't have that backlog or that jam up of, only one person be able to work at a time.
Okay, one last question, and thank you for this detail. That's helping me create a picture and better understand the current situation from what might be. Is there any time limit for processing the information that a CSI tech may come in with, say CSI tech number 2 or 3, so that it compromises the validity, not necessarily cross-contamination here, but just the length of time? Have we run into a situation like that we could not process the information timely enough so that it was court-worthy?
No, we've always gotten our evidence in a timely manner. That's why we require, on the felony violent crimes that they stay. If they have to work overtime to do that, then that's what we require, just so that we can show a chain of custody. And we recovered it that night. We got it back to the office, packaged it, got it over to logistics, that same night. So that hasn't been an issue. It's just the fact that, they'll be working overtime to get that done.
I appreciate your information. Thank you.
Commissioner Burrows.
Thank you, Mayor, for allowing me one more opportunity for questions. Colonel Vivian, the only question I would have is, I think the fact that we're in Wyandotte County, I think many of us assume that if a law enforcement from other cities within our county will have access to this lab. Can you share any type of partnership or how evidence may be utilized or contracted out involving our other municipalities in Wyandotte County?
We haven't discussed that at all. I know that. I think we've just been focused on getting our own people their own space at this point in time. There really just isn't any additional space as it stands now to bring in somebody from the outside. We wouldn't have the office space, the cubicle space, if you will, for them to, house somebody there. I guess maybe on a case-by-case basis, if another agency needed to use our lab for something, I would foresee probably that they might request us to perform some sort of service for them, but I would typically they go through KBI as well, and there's no charge through KBI. So we don't receive any requests right now from other outside agencies, but maybe once in a blue moon something might come across, but other than that, it just doesn't really happen.
And the requests may not be coming in because of the inadequate ability to address their concerns. Colonel Vivian, I do sincerely appreciate the vision to provide CSI services to our law enforcement community is so sorely needed. I stand ready to partner in any way that we can, not only to make this particular lab an accredited lab, but to do what we can to bring other partners to the table to grow our presence in law enforcement in Wyandotte County. So thank you so very much.
Thank you. We appreciate the support.
Seeing there are no more questions or comments, we'll go to the next. Thank you, sir.
Thank you.
Okay, Mayor, we will cover what we can under the radios project and let you break when we feel we need to transition for the next meeting. Matt May, Melissa Sieben, are you carrying this item?
We are, we're ready.
Okay.
Good evening, everyone. Thank you for giving us a couple minutes to explain this. My concern was brought up as part of the CMIP is that we're working with a package of radios for our radio system, which by the way is one of the outstanding jewels in the Metro. We really have a great system. The problem is that the subscriber units, what we call subscriber units, that's the end radio, the radio you either hold in your hand or is mounted in the car, were purchased in 2012 and they are all Motorola units. And the problem with that is, or the concern is, that Motorola has planned into their production cycle planned obsolescence. So we knew when we bought them that there would be an end date for their support. And we are starting to slowly get there. And I wanted to make sure that this body was aware of it because the replacement is going to be a significant price tag. Again, the background is that the radios were purchased in 2012. They ended production last year, actually, so they will not be producing any more radios. And then they're going to stop, the next stage is they stop production of the parts so that you cannot repair or replace them. That will put an end to the usefulness of that radio approximately in 2025 is their plan to stop that. So at 2025, we will have radios that although they'll still function, if they need any kind of repair, one thing will happen is that the current support program that we use with Motorola for repair and replacement will stop at that point because they don't have any parts to replace or repair with. And two is that then that radio goes from being a functional piece of equipment to junk. It's nothing, it's a brick. So the dollar amount is fairly significant and it's hard to estimate right now because we're talking about a cost of a radio in the future. But I'm trying to make sure that this group is aware of this potential expense so that we can plan for it and make it happen over time so that we don't get to 2025 and find ourselves up against both a financial and an operational wall. Because to me, the radio to a responder is as much of an important piece of their lifeline as a hose or a firearm. It's really an important part of doing their job safely and well. As far as the expense, there are lots of ways we can go about looking at this. We can purchase the radios outright over time. We could use there's a program that Motorola has where you will pay the cost of the radio over 7 years. So you're basically getting a radio that you know in 10 years will be back in this same position. It will be obsolete in 10 years, but you will have purchased it over 7 years' time. There's also less of a discount when you do that. We get a little bit of discount now over what they call straight list price when we buy radios as replacements and so forth. We haven't had to do very much of that. Just to give you an idea of the numbers, roughly there's about 3,200 radios on our system. The PD and fire represent about 2/3 of that because there's a lot of radios involved in both of those operations. In particular, fire is a little different in that their radios are intrinsically safe. And what that means is that radio is able to operate in a gaseous environment that might be explosive without triggering that explosion so that none of those gases can get in or out of the radio and could be triggered by a spark, basically, is the bottom line. That problem has already started in that now if we send one of those radios in for repair, when it comes back, it is no longer intrinsically safe. It'll still operate as a radio, but it shouldn't be used in those environments. And that's a new standard that just came out just in the last month. Other things that are happening in that arena is that the NFPA, or the standards that are set for fire department's equipment, there's a new standard being floated out there now for the radios overall, and how they should operate, what their capabilities and capacities are for storing information. And that's going to be a concern, potentially. Depends on whether we adopt that or not. But those are movements that are happening as the technology changes. So most importantly is to let you know that the bulk of the radios that we have out there now are going to fall into this category. We have purchased some new radios to replace very old radios that we had that will be on a different time clock. But most of these by 2025 will not be able to be repaired or replaced with light parts. It'll have to be replaced with a new radio. And I just wanted to bring that to the commission's attention.
Are there any questions from the governing body? I know we have a hard stop that we're coming up on.
I do not see any questions.
And Mayor, of course, we can speak to this more next week if other questions come back. But with that, I would say this is probably a good stopping point for us to break for tonight's meeting.
Thank you. All right, this ends our special session. We will convene at 7 o'clock for full